Hello, my name is Helen and I'm one of the asthma nurses from Barking, Havering, Redbridge University Trust. We are part of the North East London network and I am here today to talk to you about smart inhalers and smart asthma plans. The plan for today's session is to talk about what an asthma plan is, what a Symbicort asthma plan is and what that looks like, and how we use this. We will then talk about turbohalers, how we use turbohalers, and provide a video with regards to this. We will then talk about what to do when symptoms are getting worse and what to do in an emergency or asthma attack. We'll also advise you how you can check your asthma control and when you would need to seek emergency treatment for your asthma. Asthma plans save lives. A child with an asthma plan is 4 times less likely to have an asthma attack that requires hospital treatment. Asthma plans should be written by the healthcare professional with the child family present. A copy of this asthma plan should be provided to anybody who looks after the child. So this can be a carer, the school, a nursery. An asthma plan should be reviewed regularly, and this should always be done following an asthma attack. Asthma plans tell you what to do every day. They tell you what to do when the symptoms are worse. They tell you what to do in an emergency. For older children, we advise keeping a copy of the asthma plan on your mobile phone so it's easy to locate if you need it. As I said before, sharing the asthma plan with people who you look after the child is essential. Maintenance and reliever therapy works by giving steroid at time of exacerbation. This is particularly good for reducing inflammation in your airways. So whilst you are treating your asthma with your medication on a daily basis, this is then also used during periods of worsening symptoms and exacerbation. This gives ongoing relief for your symptoms such as breathlessness, tight chest or wheeze. Maintenance and reliever therapy has been shown to act very quickly to deal with symptoms of an asthma attack, which reduces your risk of an asthma attack, which, if it's not treated, would need high doses of oral steroids. Maintenance and reliever therapy, or MART, is an asthma treatment plan. You may previously been on a plan where you used a separate preventer and reliever inhaler or rescue inhaler. The MART regime replaces the need for 2 separate inhalers, and therefore you use the same inhaler for prevention of your symptoms every day and for treatment of your symptoms when they are worse, so cough, wheeze and difficulty in breathing. This becomes smart when you add in the Symbicort. So you are using the Symbicort red inhaler every single day, morning and evening, and then using it for when your symptoms are bad. So cough, wheeze or difficulty in breathing. And we will talk through how much you need to use in the later slide. Symbicort works because it contains the steroid inhaler that you use, and also a long-acting version of the blue inhaler that you may have used previously. So this is a combination therapy. So when your symptoms are bad, so cough, wheeze, difficulty in breathing, it will treat the inflammation on the inside of your airways as well as the bronchoconstriction, so the tightness on the outside of the airways. This has been shown to be very effective at treating asthma. So why would we use Symbicort? So Symbicort is used because there's 2 medications in Symbicort, so it's easier and more convenient to take than using 2 inhalers, so one for preventer therapy and one as rescue treatment therapy. So this causes less confusion. So your everyday maintenance dose gives you both a dose of steroid preventer medication and a dose of the long-acting version of the previously used blue inhaler. This means that you're reducing inflammation in your airways and keeping your airways open. You should find that you can breathe much more easily this way. Your reliever dose gives you the dose of fast-acting reliever medication to quickly deal with the symptoms. At the same time, it gives you a top-up and boost of your preventer medication, which helps deal with the inflammation in your airways. Symbicort is good for children or young people who have problems with compliance around taking their medication, and the reason for this is because it gives the steroid in conjunction with the rescue therapy for the symptoms. So children who are over the age of 6 years and older usually are prescribed Symbicort 100/6 for maintenance therapy only. So adolescents between the ages of 12 and 17 years will use the Symbicort as maintenance and reliever. So they will use this every single day and for symptoms when they are breathless, coughing and wheezing or tight chest. A SMART asthma plan is used for maintenance and reliever therapy, although it is important to point out here that Symbicort can just be used as a maintenance therapy for morning and evening doses only. This plan, however, is used as part of the maintenance and reliever therapy regime. Step 1 is your everyday medication. This is the medication you need to take every single day to stay well. And on this, it will state the amount of medication that you need to take, whether that be 1 or 2 puffs, and also the dose of the medication that you're taking. Step 2 is what you do if your symptoms are getting worse. And in this column, you can use up to 12 inhalations of 24 hours of your Symbicort. But however, if you are unwell still at the 24-hour point, you need to see your GP for a review. Step 3 is the emergency section. Take 1 inhalation of Symbicort, wait 1 to 3 minutes, and if there is no response or improvement, take another inhalation of Symbicort up to a maximum of 6 inhalations and call an ambulance. The following video provides information on how to use a turbohaler. This is commonly used for Symbicort. It's a dry powder inhaler. We invite you to watch the video to see how to use your turbohaler. Some people find it hard to get the dry powder medication into their lungs when they're having an asthma attack. If you've noticed this, ask your GP or asthma nurse about having the blue reliever inhaler and a spacer device just for use in emergency asthma attacks. If you do use a blue reliever inhaler for asthma attacks, then follow the usual asthma attack advice. But make sure it is well written down and clearly stipulated in your MART action plan. It's very important to mention here that if you do need to use your Symbicort as rescue therapy more than once every day on a regular basis, then you will need to see your GP. It's perfectly normal to be using it once or twice in the morning and in the evening every day as per your asthma plan, but if you are needing to take additional doses, then you will need to see your GP for review, as the medication you're using may not be adequate for your current control. Some key take-home messages following this presentation. Please ensure that you use your Symbicort as stated in your personalised asthma plan. So make sure you know whether you're supposed to be using it as a morning and evening dose with your blue inhaler as rescue therapy, or whether you're using this as part of the Symbicort SMART regime, maintenance and reliever, which, as we discussed earlier, incorporates the use of Symbicort every single day, morning and evening, and then in response to your symptoms of cough, wheeze and difficulty in breathing. Symbicort should be taken every day, even when you are well and when you are not well. Even if your child or is taking steroids, they should be using their preventer inhaler. Please ensure you clean your teeth after using Symbicort, as this does contain an oral steroid. Make sure you know how to use your Symbicort SMART asthma plan and you know what to do in an emergency. Make sure you always carry your Symbicort inhaler and your salbutamol in the event of an asthma attack. Make sure you do not stop taking any medications without seeing your GP or practice nurse, and make sure that you see your GP for a follow-up review at least every 12 months. Thank you for listening to the presentation on the Symbicort Smart regime. If you have any concerns or questions, please contact us on the contact details provided on this page. Thank you.